unexpected circumstances and the times which we are going through with COVID-19. So we have two psychiatrists today who will address the issues which our community is facing or might be facing, and how our society can be helped and can cope up with those problems. So without wasting further time, I'm going to start with our city mayor, Mr. Joseph Patey, who is here with us. He was with us last time also. So Mr. Patey, can you please go ahead and give us any updates on how the city is coping and what we can do to make it even better for you?
Thank you, Doctor. I appreciate it. I know I'll just give an overview like I did last week, then city manager at Augustus will probably go through the statistics at the hospitals, along with the way he's been coordinating the homeless and doing a great job, and some other issues he wants to address. And Dr. Hirsh will add in at the end. So this will give general overview of what we did this week. I'll start with what the press conference we had today. Again, it's good to send a message out, to practice good hygiene, physical distancing, get your source of information from government sites or your trusted news stations, and take care of the elderly and the most needy. I think check in on them, make sure they're okay. The governor pretty much stressed today, I know city manager Dr. Hirsh doing, if you can stay home, as we reach the peak in a few weeks here. Governor Baker, he asked everyone today with plans to travel to Massachusetts to reconsider those plans, especially if they have symptoms. He also recommended anyone traveling into our state self-quarantine for 14 days. He also extended the individual income tax filing from April 15th to July 15th, which will coordinate with the Internal Revenue Service. And I know, Dr. Ramzan, I know you put this out to your community, but we have the Worcester Together Fund, which is important to us to take care of the needy here in the city of Worcester in the short term and in the long term. And that's donations going to be made to Greater Worcester Foundation, Worcester Community Foundation in the United Way of Central Massachusetts. And we've raised $2.2 million, over $2.2 million to date. We'd like to triple, more than triple that in the future if we can, because the demand's going to come on pretty strong, I think, in a couple of weeks. We get a lot of good donations from a lot of different organizations. How Harvard Pilgrim gave us $10,000 today, and I know that Fallon, Bishop Burke, gave us $25,000, and Berkshire gave us $50,000. So and Areta Fallon gave us, committed to another $200,000 in their foundations. So anything you can get that word out, and every small donation counts as we go forward. And some of the other issues we discussed today is, and just put out a safety reminder to people. People are home now more than they have been in the past, and the fire department's answering fires alarms here in the city. Had one today, a 3-alarm fire, where 10 people were displaced. And the initial evidence says smoking is the issue with that, because people are going on their porches, they're lighting up, and unfortunately some of the houses are catching on fire. So we need people to try to get that message out there. Well, some other stuff the city's doing too is, we're still picking up the garbage. We're still doing all the services the city provide. We're taking the safety precautions that need to be taken in doing this. It's important to get the message, like I said last week, that, don't, when it comes to toilet tissue, don't put that. That's the only thing that should be put down the toilet. People will put these flushable wipes and everything. You're going to clog the system. It's going to cause issues in our system in your cities and towns where you live. So again, we're looking for equipment donations here in the city. Hospital shelters and first responders looking for face masks, surgical and N95 masks, personal protective equipment, personal care items, disinfectant cleaners for our shelters, for our sheets and towels. And you can go on to worcesterma.gov/coronavirus and click on need assistance for complete details of this, along with give face mask sewing instructions, and there's a video there that shows people how to do it. And you can in St. Vincent's and UMass Memorial are both looking for these. And they both have a email address if people want to donate, and you can arrange delivery. St. Vincent's is COVID-19-labor-pool at stvincenthospital.com. And UMass is supply chain donations at umassmemorial.org. And we're delivering a lot of food here in the city. A number of seniors contacted to date. We're very focused on our senior population here. We've contacted over the last few weeks 1,284 seniors. Outreach calls today are 163. Meals delivered today was 2,512. And those also include frozen meals, 1,600 frozen meals for emergencies to our seniors. And the schools delivered 945 meals today to their sites, working with Gordon Hargrove and Friendly House. And they also did 2 days extra supplies, so they had 3 supplies of 945 meals going out this morning. Again, we have a COVID hotline, COVID-19 information line, can be reached at 799-1019. And we have a nurse staffing that from 9 a.m. to 4 p.m. We received 1,900 calls in that line since we established it, and 270 of those calls have been connected to a live nurse, which therefore people who have been tested positive are waiting for their test results. As you know, Congress today passed the federal stimulus package. I think the president signed it tonight. I'm pretty sure he did. So there's a lot in this bill. There's a lot of stuff. I know a lot of people on this call probably have their own businesses, and there's some things you can take advantage of. There's going to be more to come on this. I know Congressman McGovern's put something out on this, and Senator Markey and Senator Warren. But for small business benefits, to give you some examples, there's $10 billion for emergency micro grants up to $10,000 for small businesses. There's $350 billion forgivable loan program through the U.S. Small Business Administration for companies with 500 or fewer employees. And there's $17 billion to cover 6 months of payments for small businesses already accessing SBA loans. Now, the rules will be coming out, so there'll be more on this. So we'll try to put stuff on our Facebook pages, and maybe I'll send it to Dr. Rimson so he can forward that along. But there's a lot more to it than that. There's unemployment benefits, there's housing benefits, there's a lot of things that are coming out of that. So let's see, we have this mass, I think this is a great thing the manager put together. This is the city Mass Hire and the Worcester Chamber of Commerce launched an online platform to connect residents with employers for COVID-19 staffing. So it's working pretty well, where employers are signing up and trying to match people who need jobs. And so it's been pretty successful. So if people are interested in that, you can go to masshirecentral.com/COVID-19 resources. So the line up there. And again, we put a great community together. The Worcester Together has put a number of different city personnel, social service agencies, and members of our faith-based group and business sectors have established taking care of various needs here in the city. We have subcommittees on that: housing, other affairs, food security, volunteerism, well-being and mental health. And so Worcester Together is doing that. So just trying to turn it over to the manager. Blood donations is so important right now. You probably realize that local hospitals are in desperate need of blood donations, platelets, which take about 75 minutes. And people go to 508-421-1901 for that, or give blood at redcrossblood.org. And I think with that, I can probably turn it over to the manager and a lot more. But we're working together as a community here in Worcester. Dr. Hirsh and the hospitals and the communities all working together. And city manager is pretty much responsible for that as the chief public safety officer of the city. He's doing a wonderful job coordinating this. They've been going for 18 days straight, probably 19 now. So I'm going to turn it over to the city manager at Augustus. Mr. Manager, you on the call?
Yep. Thank you, Mr. Mayor. Thanks, Doctor. Appreciate the chance to speak to folks again this week on an update. We've done, I think, quite a bit of work as a community. We opened 3 satellite homeless shelters, one at St. John's Church, one at Ascension Church, one at North High School, with the goal of reducing our shelter population so there would be more ability for social distancing amongst the homeless community. As of 1 o'clock tomorrow, we'll open a 4th shelter at Worcester Technical High School. That shelter will be primarily focused on the homeless and the individuals who are in our congregate living settings like Veterans Inc., Abby's House, other shelters within the city of Worcester, who need to be quarantined for 14 days because they've been exposed to a COVID positive person, or people who are positive, who are in that same community who test positive. We have 2 different areas, so we'll be able to keep the people who are quarantined away from the positive people, but also away from the general shelter populations. And then the COVID positive people will have a separate area with Dr. Garcia and the team from Family Health, who work on the homeless healthcare system here in Worcester, and they will be providing healthcare services to both populations. So that shelter will come online tomorrow at 1. That's very important to our hospital systems, because both of them have folks who've come in from this community who they can't send back to the shelter environment if they've tested positive, or if they've had an exposure and they can't quarantine themselves because of the congregate living situation that they're in. This will allow us to unclog some of those hospital beds at both St. Vincent and UMass Memorial, and take care of their medical needs. So we worked closely with both hospital systems to put online for tomorrow, and that should be a big help to them as they see the number of patients that coming in with COVID and more serious health complications rise. They hopefully will not become overwhelmed because they've got these other populations in the hospital space. Also, the governor has asked that several nursing home facilities be made available for overflow for regional hospital systems. There is one that's being opened here in Worcester that's going to start tomorrow. Wait for the governor's announcement on what the location is in Worcester, but the population of that nursing home will be cleared out. They'll be moved to open beds in other nursing facilities around the state, and then we'll have one fully empty facility, with the idea that anybody who comes out of a nursing home, long-term care facility in the Central Mass area, tests positive for COVID and can't return to the nursing home and doesn't need to stay in a hospital setting, does need respite type location, that this facility that's being emptied out would be a place for those folks to be able to be cared for, but also segregated from the rest of the vulnerable nursing home populations. So again, both what I described with the homeless community as well as this nursing home community are really key to us keeping the hospital systems able to respond to all of the COVID and other urgent medical needs from the community, whether it be cardiac issues, trauma, etc. We need to make sure that the hospital systems don't become overwhelmed, and these are 2 strategies that we're putting in place to try to make sure that doesn't happen. The mayor kind of alluded to some of the grant programs. We've got a lot of our small businesses in the city that have been very seriously impacted by the shutdown. And there's literally hundreds of families in the city who are impacted, whether they're business owners or they're employees of these small businesses. So the city put up $500,000 that we put out a application for a small business resiliency program that the city will give $10,000 cash in a grant, not a loan, but a grant to these small businesses that qualify. And they can use it for anything from paying a utility bill to paying their rent or the mortgage on a property or paying employees salaries to keep folks employed. We had $500,000 in that, which would allow us to do 50 grants. We've gotten 160 applications in the first week. So next week we will give out the $500,000 that we have. And then when the federal stimulus money comes to the city, hopefully in the next week or 10 days, we will make as many additional grants from that 160 as we possibly can. We won't ask businesses to reapply. We'll just put them in a ranked order, and we will go as far as the additional money allows us to get actual cash in people's hands as quickly as possible to try to save their businesses and save as many of these jobs as possible. The mayor alluded to the platform that we have on the city's website, worcesterma.gov, which has allowed displaced workers who've been laid off because of the pandemic to go on and sign up to get alerts for companies that are hiring. We've had over 25 companies and businesses that are looking to hire people. They're delivery companies, they're Amazon, they're cleaning companies. A number of different employers are actually ramping up and looking for employees. So we've tried to create this platform where job seekers and employers looking for employees can find each other and hopefully facilitate people making those connections. The shelter system we talked about, we're really looking for volunteers to support that, not the medical one. That's going to be staffed by medical folks who are going to have the proper PPE gear and have certain protocols. But the regular shelters, we're really hoping to get volunteers to help take a shift, do some of the work there to keep that running during this time. So if there's anybody out there interested in that, or know of people who might be, if you go on the city's website, there's opportunities to sign up for those volunteer shifts. We are being impacted as a city. We're up to 4 firefighters who've now tested positive, which means because of the contacts, we've probably had to discontinue more than a dozen firefighters from coming in because they're quarantined. We're continuing to try to figure out our staffing patterns so we don't have a significant loss in workforce in a way that would impact our response times for the fire department. So I know Dr. Hirsh has been working with fire departments to constantly update the protocols on testing and people who might have been exposed. I have a meeting with the fire chief and the deputies tomorrow morning to talk about how we are going to reassign different groups within the fire department to ensure we have the proper staffing, even as we become more and more impacted in terms of our first responders and the ability to maintain those response times. Lastly, I'll just use this opportunity to continue to get the word out. We are having struggles getting the community to comply with our closure of playgrounds and basketball courts and volleyball courts. I appreciate the weather is getting nice. Kids have been home for a couple of weeks. They're going stir crazy. Their parents are going stir crazy. We're certainly sympathetic to that. We don't mind people going out, taking a walk in a park, doing other things that get some exercise and fresh air, as long as they're maintaining that social distance. But crawling on the playgrounds, touching surfaces that can't properly be cleaned in between people who are using it, playing basketball with a bunch of people touching the same ball is just a dangerous thing to do in the middle of this health crisis, and something that is putting the people who are doing it at risk, the people who come behind them at a risk, and the families they go home to at risk. And so we're really trying to get the word out. I've asked the police department, the parks department, to put padlocks on all the courts and playgrounds where we have gates to do that. And we've been putting up signs, but just anything we can all do to get the word out there and make sure that, people know that those playgrounds and those courts are off limits, even while walking and otherwise enjoying the parks with some social distancing is still allowed. So I'll stop there and turn it over, I guess, to Dr. Hirsh.
Thank you very much, Ed, our city manager and mayor. And now will be Dr. Hirsh, who's our medical director for Worcester Department of Public Health. Dr. Hirsh. Dr. Hirsh, you are on. Can you?
1 second, I'm trying to unmute him.
Can you hear me now?
Yes.
Oh, thanks. Good. So my video has been very choppy, so I don't know how that's going to come off, but I'll do my best to stay on. And so my role in the incident command structure as we were responding to the COVID-19 crisis has been essentially one of being an information officer for the city in terms of contributing to some of the medical info that's coming in both from the federal and state level, but also I have been coordinating conversations with the two medical centers, St. Vincent's Hospital and UMass Medical, as well as with the two federally funded community health centers in our town, the Edward M. Kennedy Center and the Family Medical Center on Queen Street. And, I've been trying to display to the community how well and how earnest the level of cooperation and collaboration is. The two centers talking to each other on a daily basis, getting an idea of what the temperature is in the emergency department, in the ICUs, about any shortages of equipment. When they convey those things in our conference call, because of the logistics manager of our emergency operations center, we can frequently upgrade their stockpile of personal protective devices. We're also trying to coordinate with them with both medical centers, directing volunteers if they need extra staffing. We're kind of accruing at the level of the Worcester Medical Reserve Corps, which is one of our most organized form of volunteering, to just the John Q. public who calls in and says they want to participate in the effort in some way and feel like they've been either left out or anything like that. What we know about the COVID virus is that it spreads by respiratory droplets. It seems to have a shelf life on surfaces that's somewhere between 7 and 9 days. It's a very difficult thing to stop a respiratorily spread virus, and additionally one that lives on surfaces for so long. So in the hospitals, all of the personnel you will now be encountering will be wearing masks, not always the most highly recommended mask, which is the N95 mask, but just routine masks. And we actually have a campaign going on in the city to ask people that do have access to a sewing machine or just like to sew by hand, that there's a template on our city website, www.worcesterma.gov, that features how to make an acceptable cloth mask. And we will be getting word from both hospital centers who needs them most and try to help with the distribution of those masks. As far as the wave, the surge that we're seeing is occurring already in New York City and some other big cities around the country, New Orleans, Seattle, Los Angeles, Chicago, all seem to be a little bit ahead of us, and Boston, I think, also a little bit ahead of us. We haven't had to send 160 healthcare workers home with testing positive. In the city, we have probably about frontline healthcare workers is probably less than 20 who have tested positive. Some tested positive long enough ago that they're actually back online. But we know the wave is coming, and we anticipate that to be sometime in mid-April. And that might be the time when our fourth-year medical school class from UMass, which has now been summarily declared as a graduated class, is going to have cleared all the hurdles to have their licensure accelerated. And they may be our medical reserve corps on the physician level. All the 4 medical schools got permission from Governor Baker to do that. And there's lots of training going on online for the students. It's not quite clear how Worcester will deploy these students, but by that time, there may be a backup hospital in the DCU center that the Army Corps of Engineers has been working with the manager to set up, and that might be the ideal setting for some of our fourth-year students, now junior interns, to participate in. We've been trying to emphasize the term social distancing that everyone talks about is probably, in my opinion, the wrong term. I think that we've been using, the mayor and city manager, the term physical distancing, because we want people to be apart 6 feet radius around each other, because that's how far these droplets, when you cough or sneeze, can go. But we don't want the social distancing, because when everybody now has been asked to stay in their homes and try to literally, shelter in place, we don't want them to lose contact with one another. So what we're doing tonight with the Zoom meeting, what we can do with FaceTime, what we can do with Facebook and Instagram and all these other platforms is very important for a certain level of the community who has internet access, right? The ones that don't have are unfortunately some of our more vulnerable populations. And when we closed senior centers like we did in Worcester, we wanted to make sure that those folks that depended on the senior center still got their meals, still got communicated to. So we actually started a buddy program now in which our first and second year students are selected for pairing up with one of these seniors to make calls, to make sure that they have enough food and water, and that they're connecting. And we're doing a similar program starting next week with the Worcester Public Schools students who have been furloughed, essentially. There's an internet platform that they've all been given that will allow us to do some online reading of books and some tutoring, which the students are pretty excited about doing. We talked a little bit today at the press conference, or yesterday actually at the press conference, about the fact that some of the symptoms have shifted, and we're not sure if this is a shift in the demographic that is different from the United States to the Asian countries that have been going through this. There's a lot more GI disease that we're seeing. We're seeing also, I think, a lot of younger patients as well. And maybe it's the younger patients that get lower lung inflammation, and that manifests itself as the inflammation of the diaphragm, that muscle that separates the chest and the abdomen. And they then get referred irritation to the abdominal cavity. So that may be causing them GI distress like vomiting or diarrhea. more so than respiratory distress. And we've had a couple of patients that have come in, no more than a couple, where the GI complaints have been there. They've gotten their CAT scan, and on the lowest cuts of the CAT scan, where they're looking at the lung, they see the inflammatory changes that you see with COVID-19 pulmonary disease. So I am hoping that this is just a sign of the demographic maybe changing, but there's always the worry that somehow this is a strain that has changed and that the virus is mutating into something else that has a slightly different presentation. Whatever it is, the best that we can offer the community really is a separation right now, and wait for that wave to hit us. And the fewer people that have been exposed to the virus, the less likely it is that we will overwhelm the medical system. But with the leadership that UMass and St. Vincent's have both shown, I feel very confident that we are prepared. No one is panicking, as Mayor Petty says, and we know that the city manager has gotten a lot of stockpiles of PPE and other things that we can throw into the battle if we need it as a backup. So the last thing I talked about today at our press conference was the tale of Mary Mallon, who got the nickname of Typhoid Mary. In the early parts of the aughts of 1900, she arrived as an Irish immigrant to New York City, and obviously didn't have many means and was living in kind of slum conditions, but she was an excellent cook. So she started her career as Typhoid Mary as a cook, and everywhere that she worked as a cook, there was a big outbreak of typhus. And so twice the New York City police, using newly created forensic information that they were getting from the New York City Health Department, tracked down the outbreaks to Mary Mallon, and they would force her to quarantine herself at an island off the coast of the East River side of Manhattan. But she would escape frequently. And finally, on this day, this very day, the 27th of March in 1915, so 105 years ago, she was incarcerated for the last time, and she ended up spending the last 30 years of her life on that island in solitary confinement. So she is like the prototypical example of the asymptomatic shedder of disease. She never felt any symptoms herself her whole time that she lived, and she lived into her 70s. And yet she caused many, many, many deaths because of the spreading that she was doing. And I hope that we don't find out that there's a lot of Typhoid Mary type COVID virus spreaders amongst our community that are not paying attention to this shelter in place, not realizing that where they're going, they're shedding the virus and thereby spreading it to our vulnerable populations, the elderly, the people that have pre-existing conditions like lung disease, cancer, diabetes. So it's very important that we try to maintain our sense of propriety about this, keeping ourselves in the homes that we live in, and socially connecting, but doing it virtually like we're doing tonight. So I wish everybody a healthy weekend, and despite how nice the weather is going to be, enjoy it maybe in front of your house, but not in a group, and try and weather this wave until we know that we're past it.
Thank you very much, Dr. Hirsh. That was a great presentation. I can see the time, the clock is running, and we are a little bit tight with the crunch of time. There are a couple of questions. I know Dr. Hirsh, you and Mr. Augustus have to leave, but these couple of questions, let's tackle them now, and then we'll go with our medical panelists. First question is that what measures are being taken to make the grocery stores safe, especially with social distancing of 6 feet? So city manager or our city mayor, Nabil, you want to unmute our panelists, especially our mayor and Dr. Hirsh, if anybody wants to tackle that quickly.
Could you repeat that question? I'm sorry.
So the question was that what measures we are taking, especially in the grocery stores, for social distancing of 6 feet.
I know the many of the stores have instituted early hours that are exclusive for elderly shoppers as a way to keep some of the more vulnerable folks in the community separated from others. And I think that has helped to get people, into the grocery stores to get whatever provisions that they need without being part of the bigger crowds or the longer lines. That really is what I'm aware of myself. I don't know if Dr. Hirsh knows of anything else.
No, can you hear me? Am I unmuted?
Yeah.
Oh, good. Yes, Mr. Manager, I agree with you. I don't think that there have been any formal arrangements made. There are many of these big box stores and the grocery stores are hanging signage up suggesting that they don't want to have big congested lines of people. And they supposedly have extra staffing at the cashier's line so that people are not going to be in those big compressed groups. But there are also many of the stores now are offering curbside pickup if you order ahead online. So Whole Foods, Wegmans, and Big Y have that service, but I'm not sure if it's at Price Choppers or Stop and Shop. But it's worth looking at the websites and seeing whether they will do that kind of pickup service. And lastly, there are some that are doing home delivery, which is a very nice option if you can arrange it, and that will kind of limit the number of times that you have to expose yourself in those big stores.
Thank you very much. Due to crunch of time, I'll just give 1 minute for these two questions. One is that what is the plan for this technical high school medical facility? Can we elaborate a little further on that? And the nursing home which we are opening in Worcester, what type of patients there will be there? So if one of you can quickly, just in 1 minute, add to clarify that for our audience.
So the technical high school shelter, medical shelter, is going to be primarily two sets of clients. One would be people who are quarantined because they've had an exposure to a positive person and they live in a shelter or some kind of group setting that does not allow them to quarantine and isolate themselves from other folks. And so we're creating this shelter which will have the ability to have some distancing from each other while they comply with a quarantine. There'll be another section, a separate floor at the technical high school that will have people who are of that same population who test positive for the COVID-19 and will be able to receive medical treatment and be just with other positive patients away from folks who are not positive back in the shelter environment where they live. As for the nursing home, that is going to be a facility that the hospitals can send patients. What many of the nursing homes and long-term care facilities have said is a patient leaves with a COVID diagnosis, they will not allow that patient to return until the pandemic passes for fear of affecting other vulnerable patients within that facility. We've seen that devastating consequence in the Seattle area. So the hospitals don't want to have their rooms and their facilities overwhelmed with these patients once their immediate medical needs are taken care of. So this long-term care facility could be used to send those folks when they no longer need to be in the hospital, but they can't return to the original long-term care facility they came from. This would be a place for them to go receive medical treatment until they are able to go back to their long-term care facilities.
Thank you very much. Thank you, City Manager, Mr. Augustus, and Medical Director, Dr. Hirsh. I know you both have to leave for another meeting, and we are running behind schedule. But thank you again for your time. We have City Mayor who will stay like last time also till end, so we have a few questions which we'll address with him.
Thank you very much.
Gears, now we are going to move forward. Thank you. We are going to move forward with, I think we'll skip the ID updates, which we'll do later as part of the Q&A. We are going to proceed with Dr. Peshimam. He is actually a head of biosafety at Sanofi and excellent background in biosafety from that perspective, who's going to just share his expertise with a few of his slides. Dr. Peshimam, please.
Yeah, hello, everybody. Good evening. I won't take much time. I just have 3 slides for the group. The first slide, we've all been hearing in the news about the global impact of COVID-19. Obviously, it started in China. The next hotspot was in Europe. And as we heard this week, now Europe is by far the #1 country with the most number of cases. This, the data that is presented here is from Johns Hopkins. It's an active case tracker. It is updated every minute. So basically, if you look at this data and see the total confirmed cases in the world and total number of deaths, the first instinct for us is to divide the number of deaths by the cases to get an idea on what the death rate is. So looking at this graph here, if we do that simple calculation, the fraction actually comes to something like 4.5%. If you can go to the next slide, please. So, you know, when we look at case fatality rate, it is not as simple as that. As we all know, in this case for COVID-19, there are a number of asymptomatic people who would never even go for testing. So the true number of cases that we have for COVID-19, that will remain unknown for most part. I'll just give a simple example to give you perspective. We all know that in the case of flu, the case fatality rate is established at 0.1%. And in the US, we see total deaths of up to 60,000 people per year. Now, just doing a simple math, you know, a lot of experts like Dr. Fauci, who is on the Corona Task Force for the White House, he estimates that the case fatality rate for COVID-19 at this time is at least 10 times that of flu. So just assuming all other factors remain constant, if you do a simple calculation, we can expect up to 600,000 deaths in the US if we are assuming that the case fatality rate is indeed 1%. But again, there are so many other factors involved and so on. And hopefully, once we have all the data, once all the dust is settled, we will hopefully get a case fatality rate for COVID-19, which is below 1%, hopefully. You know, and another important information that was presented yesterday at the White House town hall was that of all the people who have been tested in the US, you know, the people who mainly go for testing are the people who are symptomatic. So 86% of the symptomatic people, the people who are showing signs of coughing, fever, shortness of breath, and so on, 86% of the people came back with a negative COVID-19 result. So that is just giving an idea that we have a lot of people being tested and a significant amount of them are indeed coming negative. Next slide, please. So why is all this important? You know, ultimately, we have literally the whole world is shut down because of COVID-19. And one of the main reasons we are shut down, which we have to highlight, as the previous speaker spoke, is to protect our vulnerable population. And who is this vulnerable population? These could be people who are of higher age group. That's one group. There's also people who have comorbid conditions. Again, this graph, this data is strictly taken from Chinese data, the data we received from the Chinese cases. So the first graph shows the fatality rate by comorbid condition. We can see a person with cardiovascular disease, diabetes, chronic respiratory disease. The case fatality rate is shown to be higher in Chinese patients. And also, as we all know, in the higher age group population, the case fatality is significantly increased. So we all know, we all have somebody who has either diabetes or heart disease or so on. And the fact is that in the United States alone, this group of people who we call the vulnerable population, this is a sizable group of people. So even if we do the calculations, you know, the numbers can be alarming. So that's why we have to say that we are in this together. Just because we are young, healthy, with no pre-existing condition doesn't mean we don't have to take care. It is a duty to follow the local regulatory social distancing guidelines so that we can take care of this vulnerable group. That's all I have. Thank you.
Thank you very much, Dr. Peshima. Very informative, those facts and figures, and let's hope that the fatality rate really is less than 1%, and hopefully this pandemic goes out without any major catastrophe for our country. Now I'm going to ask our pediatrician, Dr. Mohsina Alom. She herself was not feeling well, but she looks wonderful, and hopefully things are better. And thank you for agreeing to be part of the panel and giving us aspect of how the kids are affected, because mostly we were talking about old age, but we have seen in USA that many young individuals, including kids, are affected. So she will give us some perspective from that side. Thank you, Dr. Alom.
Thank you so much, Dr. Ramzan, for arranging this panel discussion. Next slide, please. So as we've already kind of mentioned, we are in unprecedented times, and we are receiving a lot of information in a very short period of time. So before I get started, I just wanted to mention that some of the information I share today may change tomorrow. Next slide, please. So what are coronaviruses and how do they affect children? So coronaviruses are not uncommon in children. There are about 3 to 4 established coronaviruses that tend to cause the common cold in kids. It trails just behind the rhinovirus as the second most common cause of colds in children. The established coronaviruses usually cause low-grade fevers, congestion, runny nose, maybe slight cough. COVID-19, which is the illness that's caused by the new coronavirus, or SARS-CoV-2, is an emerging coronavirus, and that falls along the same family as SARS-CoV-1 and MERS, as we talked about in our last discussion last week. Next slide. Can children get COVID-19? Absolutely, they can. Although children tend to get more mild versions of COVID-19. So we're not completely sure as to why this happens, and you'll hear me say a lot this evening that we need more data and we need more studies on kids. But some of the reasons we have circulating as to why children get more mild versions of illnesses because it's been proposed that kids have a decreased immune response to the SARS-CoV-2. Additionally, with those established coronavirus infections, there's a possibility that children have possible cross immunity. So because they're somewhat immune to those other coronaviruses, this may help protect them against COVID-19. And children tend to have less comorbidities. So that means kids don't tend to have long histories of diabetes, hypercholesterolemia, or coronary artery disease. Next slide. Children who do get COVID-19 tend to develop symptoms like cough, congestion, runny nose. Some kids get fevers, and the fevers can range anywhere from being low grade to higher grade, so something like 100.1 to up to 104. There are bacterial superinfections that can occur in children with COVID-19 infections, and some of those things include ear infections and pneumonia. So if your child is diagnosed with COVID-19, your child may be put on an antibiotic, but again, that's not to fight the virus, it's to fight that superimposed bacterial infection like ear infections or pneumonia. Some children who have a history of asthma may develop wheezing associated with a COVID-19 infection. And so your pediatrician may recommend that your child be on sort of like a routine ProAir or albuterol treatment schedule. There has been some data coming out that indicates using steroids like prednisone or dexamethasone may be unsafe in adults, especially adults who are in the acute respiratory distress syndrome. However, again, we don't have a lot of data in kids, but what we're finding is that we are still using dexamethasone and prednisone in kids. So if your pediatrician recommends either of those medications, you can ask questions, but don't be too nervous to try it. And then as Dr. Hirsh mentioned, children tend to have the symptom of diarrhea and nausea. And in some of the data that came out of China, they found that children had more of these symptoms than adults did. And very importantly, as we talked about before, depending on the numbers that you're looking at, anywhere between 15 to 30% of kids can present or be absolutely asymptomatic. Next slide. All children don't have mild illness. For the most part, we're finding that babies or preschool age children can have a little bit more significant illness. In addition, kids who have underlying chronic health conditions like asthma, cardiac issues, or immune issues, these children may be at a little bit of a higher risk of having more severe illness with COVID-19. Next slide. So what role do kids play in the COVID-19 pandemic? Kids actually play a really, really important role. So when it comes to having numbers anywhere between 15 to 30% of asymptomatic kids, this plays a huge role in a public health regard when it comes to a pandemic. This is why keeping schools closed, daycares closed is so important. We consider kids as being shedders and spreaders. So that means that they shed the virus and they can spread the virus. And this is really important when it comes to our vulnerable adults and our vulnerable children. So this is why really following those rules with social distancing is so important. Next slide. So lots of parents are asking if their kids can be tested. So we're finding that different sites have different testing criteria. I can say for the most part, just as we're not testing asymptomatic adults, we're also not testing asymptomatic children. Mildly ill children don't have to be tested. Optionally, we are sometimes recommending testing in kids who may have like a vulnerable family member at home, so someone who is either immunocompromised or someone who's older. In addition, we also test children who are infrequently ill enough to go to the hospital. And the reason why we do this is because if a child is in the hospital, we have to make sure that that child is safe enough and not contagious enough to be near other kids. Next slide. So what if your child gets COVID-19? There's a high chance that they probably will, and your child will do well. So, and that's because most kids have mild illness. If you're concerned that your child is ill, what you want to do is call your doctor's office. You don't want to just present to an emergency room or to an urgent care office. For the most part, your doctor's been taking care of your child since the start. So you've trusted your doctor all along. You want to continue trusting your doctor. So mildly ill children tend to just get some phone advice. For children who are a little bit more ill, sometimes your doctor will give you phone advice and possibly treat over the phone. So if your child has classic symptoms of an ear infection, some pediatricians may just send something into the pharmacy. More seriously ill kids, you want to definitely call your doctor's office because they'll be able to tell you where to go for further care. Prior to this talk, I did end up calling some colleagues at our local pediatric ER, and what we're finding in the ER is that there is a shortage of ProAir inhalers. So let's say if your child has a history of asthma or wheezing, we are trying in the emergency room and at urgent care office and at PCP offices to not use albuterol nebulizers because they can aerosolize the virus. So we're trying to ask parents to take your ProAir inhaler and your aero chamber to the office or to the emergency room if you require that type of care. So really the take-home message for this is to call your PCP's office before you go anywhere for care. Next slide. So what can you do to keep your child and your community healthy? Really, just as Dr. Hirsh mentioned before, you want to keep up with that physical social distancing. And it's important to remember physical social distancing because it's not the same as isolation. So you don't want to isolate yourself. You still want to keep up with that social media. You want to keep up with calling friends, family, FaceTiming. You want to practice good hygiene, so hand washing, and there are lots of videos out on how long to wash your hands for. Staying at home and being under quarantine are not the same thing, and I'm finding, at least in the office, that's something that I think we need to do a good job of distinguishing between. So when you're staying at home, you tend to be healthy, and you can go to the grocery store, you can go to the pharmacy to pick up medicine, you can go out for short walks. When you're quarantined, you tend to be sick. And so when you're quarantined, you do have to stay in a room and possibly, if you can, use your own restroom. You want to not go out to the pharmacy. You want to not go out to the grocery stores. You do want to connect with others, preferably with your phone, and maybe ask others to help you to go pick up your medicines or pick up grocery stores or pick up like groceries. Other things that you can do to stay healthy is make sure that your child's vaccines are up to date. So there's still time to get that flu vaccine if you haven't gotten it yet. For kids who have a history of allergies and asthma, make sure that those control medications are being taken. So keep up with the Flovent, keep up with the Claritin, keep up with the Zyrtec. Make sure you have your other refills at home. So for example, if your child has allergies that require an EpiPen or EpiPen Junior, make sure that that's at home. As I mentioned before, there's a nationwide shortage of ProAir MDIs. So ask your pediatrician to call in albuterol neb vial treatment so that you have those at home. For those that are vaping and smoking, stop, because we know that when you have underlying lung issues, you tend to not do as well. So you want to protect your lungs, so stop with the vaping and the smoking. Eat healthy. You want to take your multivitamins because it just helps to strengthen your immune system. Sleep and get rest. And then finally, I have a very brief line here that it is safe to breastfeed. And this is more along the lines for moms who are already established and nursing their young. There was just some new data that came out from the CDC just a couple of hours ago about children who, or more so newborns in the postpartum time. And so I'm not going to touch too much on that. So if you have a newborn at home and you may be sick, you may want to talk to your doctor about nursing. Next slide. You also want to talk to your kids about going on. Kids can sense when something's different. Kids can sense when their schedules are changed, and it can cause anxiety in children. And I'm glad that our psychiatrists are going to talk about this in a little bit, but have age-appropriate conversations, be honest and give simple answers. You want to empower yourself and your kids. So I tend to say don't focus on the no, focus on the yes. So you will be telling your child that they can't go to the park. You will be telling your child that they can't go and play on slides and swings. So instead of focusing on the no, rather focus on the yes, and tell your kids, well, you know, if you want to FaceTime your cousins, you can go ahead and do that. You want to stick to a routine. So just because kids are home doesn't mean they should be waking up at 11 o'clock in the morning and going to sleep at 2 o'clock in the morning. So keep up with a learning schedule, a play schedule, and a sleep schedule. Make use of your time. Take appropriately distanced walks. Learn how to ride a bike. You can virtually connect to family members and friends, and check in on one another, because we know that when we do good deeds and when we share in charity, we feel good. Next slide. And then I wanted to end with just some good sources of information. The AAP is the American Academy of Pediatrics, and they have a fantastic website for both parents and for healthcare providers. Our CDC is updated on an hour-to-hour, if not minute-to-minute basis. Healthychildren.org is also a really, really good source of information. And then finally, the World Health Organization is also a great source of information. Thank you so much for listening, everyone.
Thank you very much, Dr. Alom. That was a wonderful presentation. Now we are going to hear from Dr. Khanani, who's our hematologist and oncologist in the community, also very active in the interfaith activities. We'll be talking about medicine and spirituality and touch base on this special segment of the population, how they are affected in the current era of coronavirus, especially those who are immunocompromised. Dr. Khanani.
Assalamu alaikum. Thank you very much for doing this. So I will start out with the care of cancer patients in the current pandemic. An article was published in the journal Lancet, which looked at more than 1,500 patients who had COVID in China. 1% of them had cancer. Now, 1% doesn't sound like much, but if you look at the overall incidence of cancer in the Chinese population, this is more than 3 times as much. They also found that about 28% of these patients had lung cancer. They were older, sicker, they had pre-existing lung disease, pre-existing CAT scan abnormalities, and they were also more likely to be smokers. What they also found was that these patients were more likely to require ICU hospitalization, intubation, and overall poor outcome. So the researchers came up with 3 recommendations, which they mentioned that patients who have cancer should be postponed for adjuvant chemotherapy or elective surgery for a stable cancer. By adjuvant chemotherapy, we mean that patients who have had their cancer removed and now we are treating them for any possible micrometastatic cancer. This is called adjuvant chemotherapy, and we are trying to put a hold to it for now. The next thing was that stronger personal protection provisions should be provided to these patients, not that it shouldn't be to somebody else. And the third thing is that we should be more vigilant in taking care of cancer patients if they're present to the emergency room, because they are more likely to turn sour sooner. The other thing that I want to mention about is that we are now offering telephone visits to most of our outpatients. These are the patients who are just coming for regular follow-ups. They don't necessarily need to be seen physically. And we are reserving the clinic hours for patients who really need to be seen. The third thing which came from the American Cancer Society is that patients who are going for regular screening mammogram or regular colonoscopy should postpone it for the time being. So these are the three main instructions that we are providing to our patients. We are also trying to consolidate our patients, like instead of an entire day of clinic, we are trying to see most of these patients in the morning and allowing more time for the nurses to focus on chemotherapy in the afternoon or even go home. The next thing that I want to talk about is basically the role of religion, spirituality, and prayer when it comes to medicine. And it wasn't too long ago when it was considered to be a taboo to even discuss religion and spirituality in doctor-patient relationship. Quran mentions that alladhina amanu wa tatma'innu qulubuhum bi zikrillah ala bi zikrillah tatma'innul qulub, that it is the remembrance of God that really provides satisfaction and contentment to the hearts. And what we are going through is unparalleled in human history. Everybody is restless, be it the patient, the care providers, the families. Everybody needs some satisfaction, some contentment of the heart. Next slide, please. So the two main sources that I'm using for this, actually three sources that I'm using for this talk, are all medical references. The first one is an American Medical Association Journal of Ethics, the issue of July 2018, and it is available online. And the next one is a review article of 92 publications published in the journal Religion in January of 2016, and it is titled The Effect of Prayer on Patients' Health, a Systematic Literature Review. McCord et al. Found that 83% of patients in a family practice setting actually wanted their physicians to ask about their religious beliefs in at least some circumstances. And among those who wanted to discuss spirituality, 87%, that's a very high percentage, indicated that the most important reason for discussion was their desire for the physician-patient understanding. The number of US medical schools which are now incorporating spirituality in their curriculum has increased from just 13% about 25 years ago to 90% by 2014, and that number will be increasing. Next slide, please. The third reference, which I will recommend to every physician actually to read, is a very nice book written by a physician, Rachel Naomi Raymond, The Kitchen Table Wisdom, Stories That Heal. And I'll be talking about one story very briefly. Next slide, please. So now, how is religion and spirituality described in medical literature? So religion is described as a system of symbolic elements and rituals through which people can connect with the divine or the sacred. And I think that whether you are a believer or not, at this moment in time, everybody's looking up to the sky and saying, is there someone out there who can help me? Spirituality is a dimension related to finding meaning in life and answers to fundamental aspects of life through sacred and transcendent experiences. And I think one of the most fundamental questions that comes to our mind at this point in time is, why are bad things happening to good people? And this is where spirituality may help us find some meaning. Next slide, please. This is a quote from Rachel Naomi Raymond about prayer. And she said that I think prayer may be less about asking for the things we are attached to than it is about relinquishing our attachments in some way. It can take us beyond fear. And I will highlight this word, fear. We are all feeling fear. So it can take us beyond fear, which is an attachment, and beyond hope, which is another form of attachment. It can help us remember the nature of the world and the nature of life. We don't really pay attention to the nature of the world and nature of life. We really have no awareness, not on any intellectual level, but in a deep and experimental way. We are all experiencing it. When we pray, we don't change the world, we change ourselves. And this is what I think, emphasizing. We need to change our habits. We change our consciousness. We move from an individual, isolated, making things happen kind of consciousness to a connection on the deepest level with the largest possible reality. And the largest possible reality is that this virus is not distinguishing between any race, any religion, young, old, rich, or poor. We are all in it, not as individuals, but as the humanity together. The majority of patients believe that spiritual care provided by physicians is important, and approximately half of them indicate that they would like their physicians to pray with them. So I'll mention a very brief story, which comes from an oncologist, as mentioned by Naomi, that he was taking care of a patient who had stage 4 cancer, and there was nothing else left. So he is meeting with the patient. He doesn't know how to communicate, but he tells them, Mrs. B, I don't have anything else to treat you. But then all of a sudden he asked this question, perhaps for the first time in his life, is there anything I can do for you? The patient looked at him and said, Doctor, will you pray with me? The doctor was dumbfounded, shocked. But he said, yes, I will pray with you. They closed the door, they kneeled side by side, they prayed in their heart. Their eyes were full of tears, and God's eyes were watching them. Next slide, please. Does prayer have an effect on patients' health? And the article that I talked to you about is actually identifying 92 papers. These are scientific papers related to the effect of prayer on patients' health. They included 12 in their review, and they found that prayer was considered to be a positive factor in 7 studies, and several positive effects of prayer on health were identified. Prayer is a non-pharmacological intervention and resource, and should be included in the nursing holistic care aimed at patients' well-being. This was the gist of this 92 paper review. Next slide, please. It is often during illness that patients experience deep spiritual and existential suffering. With clinicians' care and compassion, patients are able to find solace and healing through their spiritual beliefs and values. It doesn't matter whether you are Christian or Jew or Muslim or Hindu, whatever you believe is good for you. The literature suggests beliefs and religious practices are associated with improved physical and mental health outcomes, having a beneficial effect on immune function. And we all acknowledge right now that our best defense against this virus is our immune system. Welfare, high levels of satisfaction with life, hope, and lower rates of anxiety and depression. And this can all be encapsulated by this statement of the Quran, Allah bi zikrillahi tatma'innul qulub. Next slide, please. So how do religion and spirituality help the care providers? Religion and spirituality are important not just to the patients, but also to the clinicians who are exposed to anxiety, stress, and hazards of contracting diseases when taking care of patients. The World Medical Association is calling it a pandemic of physician burnout. And if what's happening continues at the same pace over the next couple of weeks, may God help us. Next slide, please. This is a poem which I will not read through. It's called The Pulley, and it was written by George Herbert. I will encourage everybody to read it. I apologize for the typo. Basically, what the poem means is that when God created man, he put knowledge, beauty, wisdom, strength, rest in a cup. And he started giving them to men one by one until only rest remained at the bottom. And God decided not to give him rest, because he said that people will start worshiping nature rather than the God of nature, and they will not connect with God. If they have some restlessness, it will toss him back to my breast. So I encourage you to read this poem. Next slide, please. Now, what's the Islamic recipe for the care providers? The first approach that we have is actually a prayer by Moses, who mentioned that, oh God, this trial was ordained by you. Now, what's the purpose of this trial? He says, to allow to go astray whom you will, and to guide whom you will. You are our guardian, therefore forgive us and have mercy on us, for you are the best of all forgivers. The brief explanation of this verse is that when such calamities, such natural disasters occur, they can either turn people to God, who will guide them, who will reward them for their patience, or they simply turn away from God, which in fact is a divine wrath, a divine punishment. So may God help us to direct ourselves, our energies towards Him. It doesn't mean that we should not take all the precautions that the Prophet of Islam, Muhammad Sallallahu Alaihi Wasallam, said, tie your camel first before you trust in God. Next slide, please. I'll be very brief now. It's actually a 4-point agenda which is given by the Prophet of Islam when he talked about the eclipses of the sun and the moon. And he mentioned that these are just 2 of the signs of God, and there are many more signs of God. So when you are faced with a natural calamity of unparalleled magnitude, he gave us 4-point recipe. He said, first thing is that call upon God. Second thing, describe the greatness of God. The virus is great, the trouble is great, but nothing is greater than God. The next thing is pray. Turn your living room into a spiritual place. Connect with each other, pray with each other. And the next one, he said, tasaddaku. Can you move to the next slide, please? Keep moving. Next one, please. I just want to be brief. Okay. So this one I want to focus about one is called Salatul Haja, which is a prayer at the time of dire need. And it's something that we Muslims have forgotten to do. It's a very simple prayer, just like any other 2 rakah prayer. Pray whatever surah you want to pray. Thereafter, turn your face to the Kaaba, bring tears to your eyes, describe and magnify, glorify God, and then ask Him from the depth of your heart to relieve this devastating disease from our midst. Next one. Now, what does the sadaqah or charity mean? The charity actually extinguishes the wrath of God and keeps one away from an evil death. And we all can do by making donations. As the mayor mentioned, there are many foundations in our community that require urgent financial support or masks that you can sew. Feeding the needy, very important. Keep a smiling face, no matter how much you are suffering. Take care of your family, your friends, your neighbors, make phone calls, and remain connected with each other. We will survive. Thank you.
Thank you very much, Dr. Khani. I know you had to rush through it. It's just the time. We are with the crunch. We are quite delayed, but thank you for our audience for hanging in there, especially that we have an important segment of the program coming. I must acknowledge that we had Dr. Khalid Abdul Qadir, our internist, and Dr. Asim Ali, our endocrinologist, but they gave up their time because of the panel size. And our initial time went with our updates. So we are going to proceed now with our important segment of the program, which is in fact the most crucial in one aspect, that people are suffering. There's a lot of problems, especially the impact on mental health has been really amazing. So for that, we invited 2 of our community psychiatrists, especially one with Brother Imad Karim, who's expert in anxiety disorder. So I'm going to ask him to educate us about that and tell us that how community can cope with anxiety and other issues in this era. Thank you, Dr. Karim.
Assalamu alaikum jami'an. Thank you very much for this effort. Barakallah fikum, inshallah. I'm going to talk a little bit about normal anxiety and abnormal anxiety. Normal anxiety is a natural phenomenon Allah subhanahu wa ta'ala has created in us as a protective, adaptive mechanism. Anxiety in general is composed of 4 components. The cognitive component, which is the thought process. The emotional component, which is the fear emotion. The principal emotions in anxiety is fear. The behavior component, which is what you do as a consequence. And the physical component, which is of great importance, and we'll talk about why is that important. Now, abnormal anxiety is a chemical imbalance, chemical problem that affects people. And it's not an extension of normal anxiety. It's a different bird. However, it shares with normal anxiety many aspects, including the physical aspects and some of the cognitive aspects. In order to simplify this, cognitive aspects are 2 types of thoughts: the internal thoughts and the thoughts that come from outside. In other words, knowledge. What you hear, what you read can generate anxiety because emotions are generated by thoughts. In treatment, we rely on helping the patient identify these unnoticed thoughts that generate his anxiety. Now, abnormal anxiety manifests itself mainly with physical symptoms, dramatic physical symptoms, really scary physical symptoms, such as rapid heartbeat, shortness of breath, dizziness, lightheadedness, blurring of vision, tunnel vision, dry mouth, a feeling of suffocation or like a globe in your throat, rumbling stomach, diarrhea, cramps, headache, unsteadiness in your gait, feelings of wobbly, rubbery legs as if you're so weak you can't stand on your feet, tingly sensations in your fingers, your mouth, your neck, your scalp, your toes, hot flashes or chills, and sometimes a feeling of detachment as if you're not present in the moment, as if you're dreaming, as if things are not real. The person knows that things are real. He knows he is there. It feels as if he is not there. It's a scary feeling. People feel sometimes start thinking, is this really the beginning of how people lose their grab on reality and how they lose their mind? And that makes anxiety much worse. Now, in a situation like this, where the one that we're living now, misinformation plays a major role in increasing anxiety. One of the main factors that's generating anxiety nowadays is the lack of clarity. Not lack of clarity in the minds of the public only, but in the minds of professionals, because this is like a new disease, a new problem, the extent of which is not clearly known yet. The impact on, in general, is not known yet. There's no treatment, there's no vaccination. So there's a lot of unknowns, and the public knows that. So even if we are totally clear and transparent and educate the public with the proper knowledge, even the proper knowledge is still vague and ambiguous, and there's lack of clarity and a lot of unknowns, and that by itself creates anxiety. And those who have borderline anxiety may cross the border to abnormal anxiety. Now, anxiety can overwhelm the system for two reasons. When people start feeling these symptoms I just mentioned, and the person can have any combination of what I just mentioned, he doesn't have to have all of them, but these symptoms are very dramatic and very real, like the rapid heartbeat, the shortness of breath, the diarrhea. I mean, they are real symptoms, and no one can convince that person that this is anxiety because he's feeling, there's something wrong with my body. And people rush to the emergency room or to their doctor or seek urgent help because there's something wrong with them, whether it's a stroke or heart attack or. And as a result of that, the health system gets overwhelmed. There is tons of evidence in the literature, medical literature, how treatment of anxiety decreases overutilization of healthcare. In areas where there is no such proper treatment, Massachusetts, by the way, leads the world, the whole world, in treatment of anxiety, diagnosis and treatment of anxiety disorders, the whole world. So Massachusetts really is #1 in the whole world. And #2 probably comes 50 steps below Massachusetts in treatment of anxiety disorders. So we are blessed really to have those programs and those professionals who treat anxiety in this area. That will definitely decrease overutilization of healthcare. In a crisis like this, we don't want to add to the already strained health system by overutilization from anxiety disorders. And so, clinics that, in general, psychiatric clinics and clinics that treat anxiety have been working around the clock with their patients and with new patients, try to, treat that anxiety, which was probably borderline or normal, and now it has crossed to abnormal. And the person has abnormal anxiety. There are different subtypes of anxiety. There's no need now to discuss that. I'm just talking about general, the common pathway for anxiety, which in its normal form is protective. You have to have anxiety. Now, the impact of anxiety on cognition and the ability to process, that's a very important issue that needs to be addressed also. Normal anxiety, as it increases, it improves your ability to concentrate, ability to comprehend, ability to process your mentation, like, you know, your processor is faster, like a computer processor is faster. Your concentration, your ability to store and retrieve is better. Your decision making is more clear. As you cross into abnormal anxiety, all these elements start to decline to the point where the person processing becomes like very slowed down, like he cannot really think at all. When you combine that with misinformation, when you combine that with lack of clarity, you can imagine how that impacts that person. It makes his abnormal anxiety even worse. Treatment of education is very, very important in feeding the normal brain, the brain that does not have abnormal anxiety. Let's say the average person who has anxiety or borderline abnormal anxiety, feeding that brain with reassuring, important, realistic information regularly, on regular basis, is extremely important in diffusing and like combating that progressively worsening anxiety, which may cross into abnormal, and then it becomes a problem that can overwhelm the system. Quite often, in the old days before anxiety disorders were very well recognized and treated 20, 30 years ago, the systems, medical systems were really overutilized tremendously by patients suffering from anxiety. Like millions of dollars were spent in investigating patients because they have a chronic GI problem, a chronic dizziness or lightheadedness, a chronic instability of gait, a chronic shortness of breath and chest tightness, and all the physical symptoms, which are true symptoms, and the doctor can witness that and himself and say, oh, he does have those things. And so until so recently, thank God, all those things have changed, and the treatment of anxiety is available and effective. So regularly providing information to the public, educating them, reassuring them realistically, can decrease the general anxiety, and people can generally reassure each other. So this contagious anxiety factor can be decreased and diffused by educating the public. Before I close, I want to refer you to an article that I saw in the Newsweek, or somebody sent me an article in Newsweek. It talks about our Prophet, peace be upon him. Three things. I mean, the author talks about, describes several things, but three things stood out in my mind. One, the Prophet said, if a plague hits an area, if you are in that area, don't leave. If you are outside that area, don't enter it. Very clear order of quarantine. The other thing, the Prophet talks about the best practices of hygiene. I mean, there's tons of hadith about hygiene, but one important one talks about cleaning your hands before and after you eat. Before eating, clean your hands, wash your hands. After you eat, wash your hands. SubhanAllah. The other thing that Prophet talks about, that all these things are from Allah subhanahu wa ta'ala, and remind you of the greatness of Allah. But remind the greatness of Allah, it's not like an empty, mindless kind of repetitive thing. Oh, God is great, God is great. It's to remind the human being of how minute he is, this arrogant, belligerent human being who thinks he can do anything, he controls everything. Reminds him that there is a God who is actually in control and you're nothing. So be humble, and help your fellow human being. Don't be arrogant. Don't be belligerent. That article, I wish everybody can refer to it and read it. It's really a nice one, and it's in the Newsweek. Jazakumullah khair. I hope in this brief presentation I gave a little bit of an idea about what we would see. In the last 3-4 weeks, we have been overwhelmed really with work because of the heightened anxiety. Like it's hard to believe. Jazakumullah khair.
Thank you very much, Dr. Karim. Thank you for this special, perspective on the anxiety disorders. I know your clinic must be full. In fact, he told me he was running late because he just couldn't pull himself out of the clinic work. So Jazakallah, thank you for joining us. Now, last but never the least, we have another community psychiatrist, Dr. Amjad Behnasi. He's going to talk, and he selected a very interesting topic. When I asked him, he said, brother, I'm going to talk just what I have been seeing in the community for last several weeks in this era of the pandemic. So I think it will be right there. So Dr. Behnasi, thank you for joining us, and please help us with the psychiatric problems and the mental health impact in our society because of this pandemic.
Thank you. I know it's over after 9 now. We're very close to 9. I'd be more than happy to, not do it. And if there's any question or answer, so you tell me.
Well, we can, of course, with the promise that if we do the third program, you will join me next week then, if you choose that way.
No, I cannot do that. I'm sorry. I cannot do that.
Then proceed, please.
I'll take then 2 minutes only. So the first slide, please, is really a vignette from a real patient who emailed me in the beginning of this. And I'm going to take only 2 or 3 minutes only. And basically she's saying, how's it going? Are you still able to see patients with this whole coronavirus shutdown thing? I hope so. I have an appointment in April. I'm starting to get very anxious about all of the COVID-19 stuff. I work in healthcare, so I'm an essential employee. So I have to be in this and I can't stay home. I was in tears today because I'm worried about my family and my boyfriend, and I just don't know what you do. I had a panic attack today about this. I hope I can still see you in April. I think my appointment is April 2nd. Will I still be able to see you to talk about this stress? Are you okay? Is your family okay? This coronavirus is really scaring me. So you can tell from the email multiple things. Number one, she's very anxious. She's a healthcare provider. That heightened more anxiety. She's a very caring person. She is in need of help. She is stressed out. She is scared. Can you put the next slide, please? So what we try to do is calm the anxiety. And calming the anxiety, number one, acknowledging that we're all scared. We're all together. It's okay to sound vulnerable, to sound scared. You're not Superman. You're not, superhuman. And you are scared too, as I am. So I told her, we are all going through difficult times. We are continuing to see patients. So comforting her that we will always be there as health care providers. We will always be there. This office is open. We are using virtual or phone meetings, and that was a great thing by the state insurances and others. Unfortunately, Medicare still insists on video. I'm not going to get to that, but that's a little bit difficult. But so we are offering 3 things. We meet in the office or phone or video. And while we're in the office, we're doing huge precautions to keep the office clean. It's scary time, but I learned that now I think our role as leaders to comfort the patient that only we can worry about what things we can control. But things we cannot control, we cannot worry about it. Next slide, please. So her response was, thank you for your response. This makes a lot of sense. I want to worry only about things I can control like you are. As long as you all don't mind at the office, I'd like to still attend my appointment in April. If something changes, please let me know. The last thing I want to address that giving false hopes. And I think, unfortunately, that's what the administration is trying to do. Can you put the last slide? and giving a false hope that can hurt everyone, because if this statement doesn't work well, we're all going to be in big trouble and we lose the trust of the patient. Thank you.
Thank you very much, Dr. Benassi. I know the time did go out of our control in a way, but there are a few questions which we will entertain. I wanted to rather finish before 9. But quickly, Dr. Alom, there's a question for you, that is it okay to let kids play outside in the backyard with other kids?
So at this time and at this point of the pandemic that we're in, we're still trying to follow that rule of 6-foot social distancing. So it's not a good idea to let your kids play outside with other children. You know, kids don't understand what a pandemic is, and they don't understand that, you know, they can't get close to other kids, they can't share a ball, they can't share a toy, they can't go sit on a slide. And again, like we talked about before, it's better to focus on the yes and not to focus on the no. So rather than focusing on you can't go outside to play, it would be better to kind of talk about, well, you know, do you want to FaceTime with your friends? Do you want to do a scavenger hunt in the house? Would you like to go on a nature walk outside? So focusing on things that you can do with your children.
Okay, great. Thank you, Dr. Alom. Our next question is about how to distinguish from symptoms of flu versus coronavirus. If Dr. Kamar is there, we wanted to get an update from her about ID. So maybe she can give a quick update if there is something new, and especially if she can talk about differentiating between flu symptoms and the coronavirus symptoms. Dr. Kamar,
yes,
she's our ID specialist.
Assalamu alaikum, everyone. Yeah, that's a great question. However, unfortunately, I don't have a straight answer for that to differentiate between flu or cold-like symptoms or coronavirus. Basically, I would say that minor cold would have maybe mild symptoms and wouldn't last very long. As compared to that, flu and coronavirus may have more symptoms. What we are commonly seeing in them are they both seem to have fever, cough, sore throat, muscle aches. What we are seeing recently, as we know that more complaints are coming about, more GI complaints such as nausea, vomiting, diarrhea has been reported. In addition, what we have heard recently more is anosmia. What that means is there is a loss of smell as well as loss of taste has been found in patients with coronavirus. You can say that, well, this can be found in any viral illnesses, which is true. Any viral illness may have this kind of a problem as well. However, seems to be more common in people with COVID. The reason could be because what we're seeing is that patients with COVID have a very high viral load in their oropharynx and in their noses. And that could be the reason that the amount of virus present in these areas is just very, very high, which could be causing these symptoms.
Thank you, Dr. Kamar. Is there any new update from ID perspective which you would like to share with us?
So in terms of new updates, we are still continuing to ask people to maintain social distancing. We are still asking people who have mild illness to stay at home and try to treat with symptomatic measures. Testing kits are becoming more available. However, testing is still by prioritization. So certain groups would be in a priority list. People who have mild illness, who do not have any travel or who do not have any confirmed exposure to a confirmed case of COVID is still not being tested. And besides that, in terms of the preparation, I mean, we are definitely going to see a surge in next few weeks. Within, I think, next 2 to 3 weeks are very important. We are beginning to see increased number of cases. In Worcester County, we know about 219 patients. We're seeing a lot of more patients in UMass as well. So we are basically getting prepared. We are making more infectious disease teams and more spaces in our hospitals and getting prepared. In terms of treatment, the new update is the antiviral medication, which is intravenous, called remdesivir, is finally approved for trials at UMass. So we will be having access hopefully tonight or tomorrow. So that's a great news. That is one medication which I have hope move on. And that is only, that is limited to people. It has a lot of like exclusion criteria, but really limited to people who will be on bench, who are sick enough to be on that medication. And the rest of the medications are still like not proven.
Thank you. Next question is for our mayor. That Brother Nabil, can you unmute the mic for mayor so that we can get the answer? The question is that why we are not testing the temperature when people are getting into the grocery stores, when it was being done at other, like restaurants in the past, and that was being practiced. But nowadays it's not. I'm just waiting for your mic to be unmuted. Good, please.
I don't really have a good answer for that one, but I know the governor came out with some grocery store rules. I don't even think that was even thought of or part of it, but I think I'll bring it up with the Commissioner of Health tomorrow.
Okay, great. And the second part of another question is, which is on the same line, that sometimes the stores have too many people. Why can't we make a limit that only 100 people at a time, especially bigger stores? Why to have a crowded population?
Even talking about that, I think the governor even suggested that. I know I've been in some stores, they only, they have some markings and things like staying 6 feet apart to register. So I usually end up at the store at night and there's nobody there, but the shelves are empty. But no, I think those are all good questions to ask. It's something I think Stop and Shop is doing a lot of work in that area too, if I know.
Excellent, excellent. Thank you. The next question, which can be addressed by you and our Imam Asif Hirani together. The question is that what is city and faith-based organizations doing, especially handling the deceased body with prayer and all that, and how's the situation on that front?
I know from the city's perspective, from a Catholic perspective, anyways, I know the Catholic Church has priests that are assigned there. I'm sure there's other religions that are assigned there on a regular basis. Right now, it's not, the crisis hasn't reached the peak yet, so it's probably normal as can be. But I think as it reaches its peak in mid-April, a little bit later, that you're going to see probably some more rules around that too, which is a point, because of all the things we ask the faith-based leaders to do, one of the most important thing is to pray with people as they pass away, if they pass away.
Imam Asif, you want to add something from the Muslim religion practices, especially?
Yeah, first of all, thanks, Mayor, for the beautiful response, and thanks for all the people who presented. Yeah, from faith-based perspective, what we are doing, actually, we are, first of all, keeping people calm. Obviously, from the mental health perspective, there is one medical side, and then the other is the spiritual side. But to keeping everyone calm, to keeping everyone busy in the classes, teaching virtually, and at the same time helping people, telling people to help the elderly people in the community. Our youth actually came up with the project of helping our mosque youth, launched a project of helping senior citizens and giving them grocery. And all the other faith-based organizations in Worcester are calling us, and actually they want to join hands in this project. And actually, I'm feeling very proud on the youth, and I'm so glad that we had that kind of people, that kind of youth in our community. So hopefully we can move on and with other faith-based communities also. We had a conference call last week. We had a conference call this week with our Catholic community and with the Worcester Interfaith. So I'm pretty sure we all are in high spirits, and may God protect us all. And as Mayor said, we are ready for the prayers.
Excellent. Thank you, Dr. Hirani. Two pieces of information. In our chat room, you will see Dr. Karim had talked about that Newsweek article. Brother Kamal has put the link for you. If you are interested to read it, then go into our chat room and you will find that. And another brother has shared that today at White House, I believe it was announced that Apple has launched a COVID-19 application. So if you're interested in get an authentic app, then you can download that from the App Store also. Now there is a question which was asked more privately to me, that in a nursing home in Seattle, Washington, there were many patients. In fact, probably almost all of them, they showed some symptoms around the eye, like a red eye. So just before I go, either I can go to Dr. Kamar if you are still on, about the conjunctivitis, which can be a part of the presenting symptoms like the loss of taste and smell. Dr. Kamar, you are there, you want to address something along that?
Yeah, sure. It is possible, and in addition to that, we have also seen patients with, we've heard about patients with encephalitis and also seen one at UMass, which is basically like an infection in the brain. So it's possible. Personally, I have not read a report on that, but if it is definitely possible.
Yeah, I will add that American Academy of Ophthalmology actually on their website. I will probably share that link for others also, that they have put a very excellent recommendations and guidelines for their professionals and public also, that sometimes this may be the presenting symptom. So just be watchful about that. The red eye, especially, that can be a problem. And as Dr. Kamal said, that the GI symptoms are actually increasing also, which I'll share with you in a while, that how that can be. Let me see what last question if I have here, which I can ask. Yes, this is a tough one. I don't know who, maybe city officer. Mayor, this is the last one for you. Maybe you can tackle it. What is the realistic timeline that how things stand now with the social distancing and social isolation?
That's a tough one. I'm going to go with the medical experts in the city of Worcester, like Dr. Hirsh, and not the federal government's recommendation. That I'll go with the governor and Governor Baker at Augustus, Dr. Hirsh, that we're going to peak for mid-April, so that coincides with Easter, and so it's going to be well after Easter, I think. Is my right.
Yeah, I think that's the concern when White House announces that by Easter, hopefully we'll be all in droves filling our churches, which is a great wishful thinking, but the situation is to the contrary. So that's, I think, is creating some confusion also. We all want to be over with it. If it was in our hands, we make prayer and all the hopes there that you all stay safe. My apologies that we overextended the time, which was supposed to be before that. We may be, in fact, we are thinking how we can do the third program with maybe our hospital administrators from our city, especially UMass and St. Vincent, if we can get them. And one of our physicians, I want to share with you that he's a cardiologist from our community, Dr. Augustus. Unfortunately, he got affected with COVID-19. He's still going through the symptoms. We ask all of you, as a family is asking that, he has small kids, he has elderly parents at home. So it can be a tough when it's right at heart. And we are all with him in our prayers and make a lot of dua. So please, he asked the community to make dua for his fast and speedy recovery. He's a young athletic man, but is still going through a lot of symptoms, and let's hope that he recovers very well. I think it's very critical, it hurts us. It's unfortunate, physicians are at the front lines and they can be affected anytime. We pray for them, all those who are out working there to save the community, save the people, save the humanity. This is just the same thing that we are doing part of the community service. We'll continue to do as long as there's a need for it. Before ending the program, if I missed a question, if the third program happens, we'll keep you posted and we will address those questions then. But I want to thank our technical support staff, our IT experts, Brother Nabil Sheikh and also Brother Kamal Shanak, who really made this possible again. We're going through working a lot behind the scenes. And all our panelists, thank you for your time. Our city mayor, who as always last time and this time also stayed till end, to be honest. Thank you to our audience for being wonderful audience, great questions also. We hope that this is a good, simple community service for you and you benefit from it. And if there is a need, then and there's appetite, we can do a third program before we change this Friday program to another topic. Thank you very much. You all have a good night. Thanks a lot.
You too. Thank you.
Bye-bye.